The body depends on the heart's pumping action to deliver oxygen and nutrient-rich blood to the body's cells. When the heart muscle cannot pump enough blood to meet the body's needs, this is called heart failure. When heart failure develops because of having blocked blood vessels in the heart, it is called ischemic heart failure, a serious and progressive condition that negatively impacts quality of life and survival. Currently, there is no cure for heart failure. It is often managed using medications, making healthy lifestyle changes, and receiving device implants that help the heart beat more efficiently. Over time, heart failure can lead to more complex therapies like LVADs and transplantation. More recently, cell therapy has emerged as an additional potential treatment option for ischemic heart failure. Autologous bone marrow mononuclear cell therapy is the use of a patient's own cells, which are taken from your bone marrow, then delivered into the heart muscle. The goal of the cell therapy option is to try and improve heart function. Previous clinical trial research with this therapeutic approach has shown benefits for patients, including improved heart function, quality of life, and survival. It is believed that these cells release proteins that signal other cells, resulting in enhanced functional and structural heart recovery. Nothing is left behind after this procedure other than your own cells. It is still unknown if the best course of action for patients with ischemic heart failure is treatment with cell therapy. To find out, researchers created 2 randomized trials of the investigational CardiAmpII cell therapy, which the FDA has designated as a breakthrough device therapy. The trials of this therapy, sponsored by BioCardia, with support from Medicare and the Maryland Stem Cell Research Foundation, are being conducted at up to 40 hospitals in the United States to determine if this cell therapy can improve a patient's heart function, quality of life, and survival. The CardiAmpII Heart Failure 1 trial showed positive trends for improved patient survival and reduced hospitalizations for heart problems. Based on the information learned in this trial, researchers designed a second trial, CardiAmpII Heart Failure 2, to collect additional evidence on the appropriateness of cell therapy for patients with ischemic heart failure. If you are between 21 and 90 years old and have ischemic heart failure, you may be eligible to participate. Participating in the trial requires having a complete health evaluation, along with having a small bone marrow sample taken for analysis to determine if your own marrow contains the appropriate cells needed for treatment. Participation will not affect the rest of your medical care. Eligible participants are randomly assigned so that half receive the cell therapy and half do not receive the cell therapy. Random assignment is the best way to find out if the therapy is an effective treatment. After the procedure, participants are required to have follow-up visits over 2 years. During these visits, participants are evaluated for heart function and quality of life. Everyone who joins the study continues to receive their standard medical care. After the 2-year visit, participants are told if they received the cell therapy. If they did not, patients may choose to cross over and receive the cell therapy and be followed for another year. While there is no guarantee that participants will personally benefit from participating in this cell therapy trial, the information that is collected will help advance science and help future patients and generations. Research has shown that patients who join a clinical trial generally do better health-wise because they are followed closely by the medical research team conducting the study. If you are interested in participating, our research team will be glad to discuss this study with you further.